Singapore is in its fourth doubling cycle of COVID-19 transmissions, with daily cases set to cross 1,000. To slow that trajectory, the Pandemic Task Force has announced a slew of measures, including allowing more infected people to recover at home. Shilin Xie reports.
From Saturday onwards, fully vaccinated people aged below 70 can recover at home. It's another step up from Wednesday when home recovery was first made the default model. Currently, around 600 patients have been on the scheme, about 30% of cases. The task force says these moves are to ease the burden on the healthcare system. As Singapore prepares to be COVID resilient, Health Minister Ong Ye Kung mentioned three uncertainties in the road ahead. 1. Daily cases rising exponentially and when the numbers will go down. Second, whether we run out of ICU capacity. And third, the pressure on hospitals and their beds. So the home recovery scheme is expected to provide some relief, and the country aims to get 70% of patients to recover at home in the coming weeks. The public can do their part as well to bring down cases. Everyone, especially seniors, should reduce social interactions and activities.
To adjust our social activities so that we spontaneously know how to adjust and adapt to the virus and achieve an equilibrium. Something that society is able to calibrate, to self-test, to get ourselves vaccinated. And these are steps that we take as society in order to reach an equilibrium with the virus. To live with the virus, I think this is an inevitable process that we need to go through.
Alongside another call for vaccination, the task force announced new data showing its benefits in preventing severe illness and death, as they directly correlate to age and vaccination status. Based on data since May, for those unvaccinated, there were no such cases in those aged below 30, but the percentage increased with each age cycle. For those in their 40s, it was over 1%, then 6% for those in their 60s. And the most at risk are those above 80 years old, where 15% of them were in the ICU or died. So the task force is again encouraging everyone to get their booster shots, especially the most vulnerable seniors. Mr. Ong says everyone needs to do their part, as our actions determine how fast cases rise.
We are not the first country to have gone through this baptism of fire and will not be the last, but our position is different because we are more than 80% vaccinated. And we are not completely helpless to determine how the situation will unfold. We can all do our part, and with collective effort and will, we can overcome this.
The task force also mentioned that they'll be allowing a mix of mRNA vaccines for boosters, meaning those who were previously jabbed with Pfizer can opt for Moderna as a third dose, and vice versa. Further guidelines are expected to be issued soon.